Good evening, Dr. Galiwango. My name is Okello Andrew Peters, the class representative of the current Computer Science class 2024. So this week I've been writing my exams. That is why I a bit delayed sharing this video. But let me straight away share my screen. So this is the research I'm planning to undertake, and the title of the research is integrating non-communicable diseases, mental health, socio-economic and environmental factors for life expectancy prediction in sub-Saharan Africa using random forests, ensemble learning, and long short-time memory models. A brief description. Life expectancy is a critical indicator of public health, yet in sub-Saharan Africa, life expectancy remains relatively low due to multiple factors, including the burden of non-communicable diseases, NCDs, mental health, maternal, newborn and child health, MNCH, environmental stressors, other health factors, and socioeconomic factors. So this research aims to develop a predictive model using machine learning to estimate life expectancy by integrating data on MNCH, mental health, NCD, prevalence, and environmental/climatic factors, which could provide actionable insights for policymakers and other stakeholders in the sub-Saharan African region. So the preliminary literature review, there is work that has been done around life expectancy. For example, a machine learning approach to life expectancy prediction using socioeconomic, health, and environmental factors was previously explored by Abu Hashem, who demonstrated that random forests could accurately forecast life expectancy when trained on diverse datasets. Research by Anand shows that NCDs contribute to premature mortality, impacting life expectancy significantly. Meanwhile, the World Health Organization highlights how environmental changes such as rising temperatures, air pollution, and extreme weather events disproportionately affect health outcomes in vulnerable regions. So what are the gaps in existing literature? The first gap is NCD environment interaction. Limited research explores how NCDs interact with environmental factors such as air pollution's effect on respiratory uh, uh, conditions. Another gap is regional specific models. Most existing life expectancy models are either global or focused on high income regions. Few studies model life expectancy specifically for sub-Saharan Africa. Policy-driven prediction research is scarce on predictive models that support health policies, particularly for sub-Saharan African countries facing both high NCD prevalence and climate change impacts. Integrated healthcare models. Research often isolates NCDs, MNCH, or infectious diseases, failing to address their interactions. For example, studies on life expectancy prediction by Hashem used machine learning to incorporate socioeconomic and health data, but excluded mental health and environmental stress as critical in sub-Saharan Africa. So the main objective, my main objective is to develop a predictive model for life expectancy prediction in sub-Saharan Africa by integrating non-communicable diseases, mental health, and key programmatic areas such as uh, MNCH, reproductive health, HIV/AIDS, and TB, along with environmental factors and other health factors and socio-economic factors. The specific objectives are to assess how NCDs, mental health, and environmental factors influence life expectancy in sub-Saharan Africa. The second one is to identify key features of variables, including specific diseases and environmental factors that significantly impact life expectancy in sub-Saharan Africa. Another one is to provide actionable insights that support healthcare policies addressing NCDs, mental health, MNCH, reproductive health, HIV/AIDS, and TB. So these are my research questions. The research question number one is, how do non-communicable diseases and environmental factors influence life expectancy in sub-Saharan Africa? My second objective is what roles do mental health conditions, maternal and child health outcomes, and HIV and other NCDs play in determining life expectancy in sub-Saharan Africa. And the third one is which specific NCDs and environmental variables have the strongest correlation with life expectancy in this region. And number 4 is, can an AI model incorporating these factors effectively predict life expectancy and support health policy recommendations? So that is what I have, because I was limited by the number of slides. There were supposed to be 6, but possibly in another presentation I can talk about the methodology, the data sources, and all that. Thank you very much, and I really thank you very much for your time and consideration to supervise my work. My name is Okello Andrew Peters once again, and thank you. That is what I had.